Thank you for being here. Today, what I'd like to talk about is otitis, chronic recurrent otitis externa, because it is a very common situation in practice. And I think that many people are definitely frustrated with that. Somehow my screen is not advancing. I don't know why. Okay, here you go. The reality in clinical practice is that the majority of otitis cases are recurrent. And sometimes they recur very quickly. Sometimes they recur a couple times a year. It is very unusual that the animal has just one case of otitis without any additional relapse. So the question is, when we see a patient in practice that keeps coming back to get drops, is whether this is still a case of otitis externa or is progressed to an otitis media that manifests as otitis externa. And it's very important to discriminate between these two possibilities because the treatment is different. So if I truly still have otitis externa and it keeps recurring, then it means that, and typically that means it's recurring every few months. So it's not within weeks, but like every 3 or 4 months requires drops. Then it means that there is a very good underlying cause that has not been addressed. And as long as it's not addressed, the disease will keep relapsing. However, if at this point the patient has otitis externa media, which actually is excruciatingly common, there's a study that has looked at recurrent otitis externa cases, and over 85% of them had an undiagnosed otitis media as well. Then the media acts as a perpetuating cause. So even if I fix the underlying disease, let's say allergy, but I don't do anything for the media, then the externa will keep coming back because it basically acts as a perpetuating cause. So how do I decide as a clinician if when the patient comes back requiring more medications, whether this is a true recurrence or is a refractory case? And one thing that I find useful is to look at the relapsing interval. So if it's something that is taking more than a couple weeks, so then it means I can truly believe it is a new infection. It's a new episode, there's a persistent cause, I need to do something about it. If they keep coming back to me in less than a few weeks, requiring more drops, it means that that infection never really completely went away. It looked like it did, but it did not. And so most likely because there is an otitis media that was not diagnosed, and as I put the drops, what I'm doing is I'm cleaning up the part more toward the outside, and it looks like I'm making progress. And the moment that I stop the drops, I'm right back to where I started. So I try to come out with reasons for a treatment failure based on my clinical experience. And I find that the single most common situation is because people tend to focus their attention on the specific infection. They prescribe drops and they keep doing this in a vicious cycle, but they don't really look at the overall bigger picture. So they don't address the underlying cause. Another reason is insufficient duration of treatment. So the treatment is too short, so it looks like life is good, but is not. And many times it's because people fail to diagnose otitis media, because many of these patients don't have obvious neurologic signs, so they come across as if they have just otitis externa, but that's not the case. So that is a very common situation in my experience in practice. And in the treatment error is that many times people don't do aggressive deep ear flushes. So they treat topical with drops, but they don't address the bulla. So all the material that is in the bulla keeps getting released, and it basically acts as a source of constant reinfection for the external ear canal. And many of these cases are just treated topically and not systemically, which is what is actually needed for otitis media cases. So when we look at otitis externa, as a way to kind of quickly figure out how I need to think about it, I need to think about predisposing, primary, and perpetuating factors. And as a clinician, I need to address all of it in order to be successful. If I just do one without the other, then I may be a failure. For example, if I just address infection and not the underlying allergy, I'm going to be stuck in this vicious cycle. So this is kind of like a way to kind of show how to kind of look at these various factors. Predisposing is something increases the risk of developing a problem, but by itself is not strong enough to cause one. So for example, pendulous ears, hair in the ears, and so on. Primary is something that is strong enough to cause otitis by itself. So for example, if you have a foreign body, if you have allergies, so if you, that is strong enough to cause the problem. Then infections are always secondary. And my experience, and this is true for dermatology in general, people focus a lot on the infection and they kind of lose the bigger picture. And so the infection, always secondary, is basically happening for a very good reason. And yes, I need to get rid of it, but I need to ask myself why this is happening. And then the perpetuating factor is something that prevents a resolution. So for example, middle ear disease, so otitis media, or pathological changes of the canal. So again, quickly looking at predisposing factors, most of which you cannot do anything about, it just basically increases your awareness. You know, some breeds are born with narrow canals or pendulous ears, and so certainly that increases the risk for a problem. The lifestyle, you know, so frequent swimming, exposure to moisture, you know, that is a lifestyle. Having said that, you can have 10 dogs swimming and only one getting a problem, so it's not strong enough to cause a problem per se. My experience also, sometimes people become overzealous in how they handle the ears. For example, they understand that too much hair is not good, and they start plucking hair very aggressively, and that in itself causes trauma. Or they start cleaning all the time, and wax and some beneficial bacteria are necessary. So we don't want to get rid of whatever the normal flora is if that animal doesn't have a problem. Primary causes, on the opposite of things, are strong enough by themselves to cause otitis. Allergies are a big one, like the Westie here in the picture is an atopic dog. Foreign body, of course, is strong enough to cause a disease. Autoimmune diseases, cancer, parasites, ear mites. So those are all things that without any predisposing factor can cause otitis. I want to share with you, this is a case I just saw a couple of days ago. This dog had been treated for 3 years for recurrent otitis externa with drops. Okay, it would get better and then it got worse again within 2 weeks or so. They needed more drops. We did a CT, and you can clearly see that on one side the ear canal is completely obliterated. Okay. So what we did, we set up for a deeper flush to kind of like assess and see what we could do for the removal of destruction. And this animal had all these masses. We sent it for histopath, so I don't know what the nature is. But basically, it was necessary to do some imaging and a deeper flush and going in to remove this. It wasn't just a matter of prescribing more drops.